let's just say cortisol is the drain in a tub, okay? You have all these mechanisms to start filling up the tub. Cholesterol obviously is the first, okay? So let's say the cholesterol is the faucet, okay? When I turn the faucet on, it starts to release pregnenolone, and that's the water. Pregnenolone will convert to progesterone, will convert to 17-hydroxyprogesterone, and then to cortisol. So you turn on the faucet and water comes out. If you don't plug up the tub, if you don't make sure you're supporting cortisol, everything is going out. So you're never going to build up progesterone. I don't care if you slather progesterone all over your body until you support that cortisol, because that's what the body needs. You will die in the body's mind if you don't have enough cortisol. You're not going to die if you have hot flashes in the body's mind. You might think that, women might think that they are, but not necessarily. So you have to make sure that you're supporting cortisol. And this is the whole thought behind, infertility, where women will try, and men, they'll try to get pregnant, and then they throw their hands up and they're like, you know what? Let's just adapt. Stress comes down. They don't need as much cortisol. Progesterone increases. Boom, they get pregnant.
Welcome back to High Intensity Health Radio. It's Mike Mutzel, and you're listening or watching, if you're on YouTube, episode number 67, where we caught up with Dr. Michele Nickels to give you perspectives about natural ways to balance your hormones and ameliorate some of the common, issues that many women have during the middle part of their lives. And so we're going to give you natural strategies, again, to heal your adrenals, to heal your gut, to eliminate pathogens so you can feel better and not have these hormonal issues. And we caught up with Dr. Michele Nickels. And the reason why we caught up with her is she's a very busy clinician. She has over 3 clinics in the Milwaukee area, Milwaukee, Wisconsin. She has many different practitioners working for her. Every time I go to her office, the waiting room is just jam-packed with people. So I wanted to kind of pick her brain and kind of see what she's doing in a clinical practice setting. And she did not hold anything back, and she is so passionate and so knowledgeable. So I think you're really going to enjoy this episode. And if you want to access the show notes, or if you're watching this and you want to listen to it on your iPhone or something, or if you're on your iPhone and you want to watch it over there on YouTube, just go to highintensityhealth.com/drnickels. I posted the video and the audio version there, links to her website and her contact information in the show notes. So really hope you enjoy this episode with Dr. Nickels. And if you have any questions or comments, just type them in below, and I would love to hear from you. Dr. Nickels, thanks so much for being here at High Intensity Health Radio. Very excited to talk with you today about hormones. How are you today?
I'm good. Thank you for having me.
Awesome. So we're here at your business, Integrated Family Wellness Center in Brookfield, Wisconsin. You have 3 different clinics. You've been doing this a long time. You stay very busy. How did you get into integrative medicine?
Well, I'm from Wisconsin, and I went to college in La Crosse, and I was a nursing assistant, and I worked on a surgical unit, and I just saw healthcare from a different aspect. I would take the patients for a walk and notice that they didn't need as much pain medicine. Or I'd come there and paint their nails and, notice that, they're feeling a little better. So I knew that there was so much of a mind component in regards to health, not just about, taking out the disease part and, there you go. So I was pre-med to begin with, so I was going to go to traditional medical school, and then my mind kind of changed a little bit, and I did some research working with DOs, and wasn't really sure that was more of the integrative approach, just because of, I think, a transition in philosophy. And then I was going to be a chiropractor, actually. So a week before I was going to go to Palmer and be a chiropractor, my brother, who is also a naturopathic physician, found out about naturopathic medicine. And so every aspect of what naturopathic medicine was about was everything that I wanted to do. So it was like, there it was. And so my brother, who graduated from the same school in Arizona as I did, 6 months behind me, is also a physician in Hawaii. So, cool. So it was really experience, and I think, if you're going to be in the healthcare field, you really need to experience patient care. And I really literally started from the bottom up. Taking care of patients, toileting them, all of that stuff. And you really do respect every aspect of the person cleaning the floors, all the way up to, the surgeon and the anesthesiologist, because they all work as a team, and their job is to secure the, the safety and the health benefits of that patient. So yeah, going to naturopathic school has been, it was amazing. It was definitely hard. I think a lot of people think naturopathic medicine is not really medical school and stuff like that. I mean, I have a double major biology chemistry. In my first semester in naturopathic school, I was about to quit. It was just very intense. And so, our program is throughout the year. So, it was actually 5.5 years. And we learn everything from primary care to all the integrative medicine. So you do have the best of both worlds because you get trained in, the allopathic medicine, but also the naturopathic medicine. But the philosophy of application is ingrained day one of naturopathic school. And so that has really transitioned, my practice over the past, 12 years in regards to how we were trained as naturopathic physicians, but how I've evolved from as a clinician over the past, 10 to 12 years.
Yeah.
So it's been very interesting. It's been a very rewarding career. And I think being in Wisconsin, we're a little slower in regards to medicine, but, over the past 10, 12 years, I've seen such a change, not only in consumers, because this medicine is consumer driven, but also in the practitioners and their referral to, physicians like me, and then also other practitioners I have in the office. So I've been very fortunate, to, have the different locations and have the, the people in my office, to provide that care for patients, over the past, we've been here since 2008. So, even though I've been in practice for, I think about 11, 12 years, I was doing corporate wellness and then, came over to private practice in 2008. So it's definitely been transition. And I think, just from, training as a naturopathic physician and just my learning, throughout the years has really made me, I think, treat a little different than, other naturopathic physicians and even, allopathic doctors that do integrative medicine. So, to me, it really, my practice really focuses on what is the core foundation in regards to what's causing the patient's symptoms. It's not about symptom relief. It's not about using allopathic medicine or naturopathic medicine from a allopathic standpoint. It's really about what is the underlying cause and then addressing that, and then patients get well. And it's so awesome.
Love that approach.
So awesome. Yeah. And I think, with integrative medicine, people think, oh, well, I have depression. Well, we'll give you St. John's wort instead of an SSRI. And so, my rebuttal to that is, well, what's causing the depression? Is it really a serotonin deficiency? It might be. But using St. John's wort does not address the cause of a serotonin deficiency. So you can Band-Aid things by giving, an SSRI. You can Band-Aid things by using St. John's wort for depression because that is a potential indication for that herb, but that doesn't address the core foundation of what's going on with that patient. And I've actually come over the years to a love of some medications because it's not about choosing one thing or the other. You can definitely do collaborative care, and because of our training and things that way, we have the capabilities to do that. And it's been, amazing. I mean, obviously my goal is to do what's right, for the patient, and everybody's definitely different. But, blending both types of medicine is sometimes really appropriate. So I've seen some really good results with that as well.
So let's talk about those results in blending the medicine when it comes to hormones, because I think that's where we kind of, what you described to me, I kind of refer to like as green medicine.
Yeah, I love it.
Oh, you're depressed. Okay, you instead of the drug, you need the natural equivalent of the drug.
Right.
But it still doesn't get to the root causes you talked about. Now, I think the knee-jerk reaction for hormone imbalances, everything from hot flash, mood disorders, memory issues, a lot of people do the green medicine approach of the bioidentical hormones, which obviously they work, but it's not the underlying issue. So let's dive into that, because that's an area you specialize in. As we talked about earlier, we were joking, fat, fatigued, and depressed is something that a lot of people unfortunately struggle with. Walk us through that workup.
So, unfortunately, the number one cause of disease is stress in my eyes. It affects GI function, it affects neurotransmitter production. I mean, stress is the cause of disease. We have patients as, all the way from infants all the way to the elderly. And we see hormonal change, really throughout people's progression. You look at, menarche and, things that way, all the way to, perimenopause to menopause. With that said, we still have the same stressors in our environment. That never changes. And if you really look at the progression of when we get older, we actually have more stress, right? We're parents now. We're working parents. We have, rental properties or whatever it is, okay? So we still have the stress there. Okay, so the stress is still coming in, but as we start transitioning through, perimenopause, menopause, our hormones start to change, But that need for us to deal with stress is still there. And that is the number one cause of hormonal problems. Now, I'm still working on my pill to get rid of people's stress. I haven't gotten to that yet. Maybe Zymogen can come up with something, and I'm waiting for somebody to do that. Because ultimately, if you could get rid of people's stress, I think that the rate of illness and disease would be dramatically cut, I actually think, by 75%. I mean, I actually feel like our environment does produce that much stress from a physicality standpoint, that contributes to disease. With that said, hormones in general start to change, mid-30s. That's why women are considered at risk for, pregnancy problems, and, they call it advanced maternal age. And that's because hormones start to change around age 35. Hormones start to decline. The problem is your need for cortisol is still there. Your need to get out of that stressful situation is still there. So it is the decline in hormones and the need for cortisol to still be there that causes that imbalance. So what a lot of people don't understand is bioidentical hormones, yes, it's more natural, it mimics what we naturally produce, but you can use bioidentical hormones in the wrong way if you're just focusing on band-aiding the problem. What I see this a lot when patients come in to do bioidentical hormones, or they've seen another practitioner that, does like the pellets and, the creams and all of that stuff. And I kind of shake my head when they come in, because when they come in doing the creams and the pellets, my hands are tied, because it's a surgical procedure to remove the pellets, and it's in there for about 4 months. And in regards to the cream, from a bioavailability standpoint, it is superior. The problem is, though, is hormones are lipophilic. When you put it on your skin, it stays in your fat cells for up to 2 months after your last dose. So to do any hormone regulation or hormone testing is very hard. And what I see with a lot of clinicians that do the creams and the pellets, they're doing hormonal testing from a blood test, which is not accurate, okay? Hormone in the blood is bound to albumin, which is a protein, okay? And the protein is like the driver to take it to the tissue, okay? So I don't really care how much hormone is in the blood, because the body can't really use it. It has to be dumped off at the tissue, unbound, okay, for the body to use it. So looking at hormones in the blood, for the most part, they're always low because they're at the tissue. So a lot of these doctors, even though they're using bioidentical hormones, is doing testing that is unreliable, okay? And then they're still giving bioidentical hormones, but they don't need it. They don't need it. So you can still have people potentially have problems with bioidentical hormones if it's something that they do not need. In 12 years of practice, I've never given estrogen once. Wow. Ever. And I fix people all the time. I get rid of their hot flashes, night sweats, fatigue, all of that stuff. I rarely use progesterone. Rarely. Because it's looking at the hormonal cascade, and you look at the precursor hormones and see where the body is kind of shifting things, and that's how you address things. It's not about giving estrogen, progesterone, testosterone. It's not about that. It's about doing saliva testing, looking at the unbound form of the hormone, what the body needs at that time. Obviously, if it's a menstruating woman, you check during, different times in the hormonal cycle. In regards to men, I mean, you can do saliva testing really any time. I see a lot of women come in with low libido. I rarely see low testosterone from saliva testing. So testosterone deficiency, I don't see very much. Why do people have low libido? Because they're stressed. They don't sleep well. Their husbands, whatever, right? Their kids, they're having hot flashes. They don't feel good about themselves. That's the 80%. I have yet to see miraculous results from testosterone. What I have seen, though, is people coming in on testosterone from other practitioners, and their anger is off the charts. They're developing belly fat because that testosterone is aromatizing to estrogen, because they're not doing the appropriate blocking, if you want to call that, in regards to where that hormone can go, okay? I had a patient that came in on testosterone pellets, and he had so much aggression that at the gym, he was breaking equipment.
Wow.
So they actually had him leave. They said, hey, guy, this is just insane. Yeah. And that's because of the testosterone. So not only did he not need it, because the testing that I did on him from saliva testing, his testosterone was off the charts. From a blood testing, it was borderline low. Well, that's because it was all at the tissue, ready to go. Mm-hmm. He was also aromatizing to estrogen, which is causing, he was having hot flashes. He was having a lot of hormonal problems. And that's because nobody was addressing that. So taking something, whether it's bioidentical or not, if you don't need it, it can definitely cause problems. And a lot of people don't understand from a progesterone standpoint, it's at the top end from a hormonal cascade. It goes cholesterol, pregnenolone, and progesterone. Progesterone is the precursor hormone to produce cortisol. Progesterone, so if you take progesterone, it can also increase estrogen. It can also increase testosterone. Okay, it can also increase cortisol. So what I see a lot of times too is, women will come see their doctor. Oh, the doctor does bioidentical hormones. They're not sleeping well. Oh, well, we'll use some progesterone cream at night. It helps. It's very calming. It kind of acts like GABA, which is an inhibitory neurotransmitter. This is great. You're going to sleep well. Well, the problem is their sleep problem was not a progesterone deficiency. It was because their cortisol was elevated at night. And now they're giving them more progesterone at night, which is converting to more cortisol, which is causing problems losing weight or losing belly fat or whatever it is.
Wow.
So I think bioidentical hormones have a place, don't get me wrong, but their utilization has to be applied in an appropriate way. And first and foremost, I don't care whatever medicine you do, you have to be a clinician, you have to be a diagnostician. You have to rule out things, you have to do the appropriate testing, because I can tell you, our patients get well quick, they get well fast, because we do the right testing, we listen to our patients, and they tell us what's wrong. I mean, they really do. And I think that, what we can provide patients is the time and the education so they can ultimately make the right decision for them and they can heal themselves. Mm. So too much of a good thing is too much of a good thing. So, I've seen clinically people getting better, and I've seen clinically not the need of doing a lot of medicines, even natural medicines.
Really good approach. And let's pause right there and then dive into that in a little bit more detail. And you have 3 different clinics, multiple practitioners. So obviously what you're doing is working. Yeah, so let's talk about what you're doing. It sounds to me like you rely on the saliva test, which I think a lot of people, when they go to the doctor, they're used to blood tests for hormones and everything else, from CBC, thyroid, differential. So talk to us about the different ways, because I think that's a huge point. The hormones are bound to binding globulins, albumin. People don't really understand that because you just can't have free testosterone and cortisol floating around or you'd be a mess all the time.
Right, exactly.
So talk to us about the testing that you use and what are some patterns that you see?
So, we do a lot of traditional testing. So we have a lab on site here. And so we'll do the traditional CBC, CMP, we'll check all the thyroids. We check free T3, free T4, reverse T3, the autoantibodies. We'll do, B12 testing, ferritin testing, a lot of the non-traditional tests. We'll check for glutathione and T cells, look at immunoglobulins, depending on immune function. We look at a lot of zinc because that plays a huge role in hormones. So, those are the, some of the blood testing that we do. And then in regards to, depending on the patient's case, we'll do some urine testing for neurotransmitters. And this has been... We've been doing this testing for, I would say, a couple years, and it's probably been the 25% of the patients that we couldn't get well. After doing saliva testing and blood testing, everything that came up on their hormonal testing, we would treat the abnormalities, and they weren't feeling any better. So it's really taking a step back and saying, okay, what else is going on with the patient? Doing the neurotransmitter testing, which influences the functionality of the hormones, is probably how we should have started with things. In hindsight, when it's broken, don't fix it kind of thing. But, we use the neurotransmitter testing, and that's really looking at serotonin, dopamine, epinephrine, norepinephrine, looking at GABA, looking at PEA. So this plays a role in hormones. A lot of doctors prescribe antidepressants for hot flashes, right? Most women take to offense because they think that the doctor thinks that they're nuts. They're actually not nuts, but serotonin and estrogen, their chemical configurations are very similar. So when you give a woman estrogen, who's, 55 or whatever, the body's like, oh, she's not 55. She's 20. Let's get rid of the hot flashes. She's not menopausal. So the hot flashes go away, but not in the right way, because it's still false. It's the same thing when doctors prescribe birth control pills. Sure, the hot flashes will go away, but what's the long-term effect of that, and why? Because the body thinks that it's not, 20 or 50 or 60. So doctors will prescribe birth control pills to get rid of hot flashes and deal with hormonal stuff, and essentially, puts the body in an abnormal way, but the body thinks that it's not its age, so it gets rid of the symptoms. Again, what's the long-term effects on that? So really looking at, the neurotransmitter piece, doing urine testing for that plays a role in the hormones, and then doing saliva testing for that is really important too. We do a lot of saliva testing for gluten intolerance, which obviously helps us, refer to our dietitian, who is like the expert in, gluten intolerance and celiac and, leaky gut and all of that stuff. So, when we have the different practitioners here, I don't think that we're all good at, everything. I think we're all good at certain things. But with that said, we have the good practitioners here so we can inter-refer. We have the nurse practitioner, we have MDs here, we have PA here, and they do a lot of our primary care. They do a lot of the hormonal stuff and neurotransmitter stuff. So I've actually had the pleasure, I guess, of training all of them in integrative medicine. So it's been nice. So we all kind of speak the same language, which is good when we inter-refer, because the last thing we want to do is complicate things and make people confused. Well, this person is saying this, but this person is saying this, and that's not continuity of care. Mm-hmm. They get that in the traditional realm, when they see their neurologist and their primary care and their endocrinologist and all of that. We focus on treating the person as a whole, and if we need to refer out from a specialty standpoint, we do that, but it's very rare. Mm-hmm. We've been able to keep everything in here for the most part, in-house, which has been good.
So from what I gathered, that was a great overview. About 25% of your patients that you tried everything and it didn't work, neurotransmitter testing is helping because they play such a big role in hormones.
Right.
But let's talk about hormone testing and using the saliva and different components. Dive into that a little bit.
So the saliva test that we do checks circadian rhythm of cortisol. It checks a lot of the precursor hormones like 17-hydroxyprogesterone, checks DHEA, does look at gluten intolerance, checks gut immunology. It can check insulin levels, and we'll check all of the hormones. So I check estrone, which can increase risk of cancer potentially. Estradiol, which is the most abundant estrogen in the body. It does have the capabilities to check estriol. I don't, though. It's the safest of all three estrogens. It doesn't back convert, so it's not going to feed into estrone or estradiol. And it's highest during pregnancy, and most of the women that are coming in, I'm not checking hormones during pregnancy because they're going to be off. So the saliva test that I do on patients, if they're postmenopausal, they can do it anytime. If they are still menstruating, I do check their hormones during the luteal phase, which is around day 21, give or take a couple days on either side. And essentially they take the test home, and they have sample vials that they check throughout the day, and they sample their saliva, and we send it into the test or the lab, and then they do the analysis, and we get the results back in 3 weeks. I have to say there's other companies out there that do saliva testing. The company that we use, I feel very confident in their results. I've talked to the physicians on staff there, and they've been very good about, questions that I have and kind of things that way. For instance, we have patients that come in here that are very well educated already. They've been getting off the gluten and, all of that stuff. And so when I do saliva testing and their gluten intolerance, their gliadin test comes up positive for gluten intolerance, I kind of look at the patient, I'm like, are you sure you're really gluten-free? And they're like, Dr. Nickels, yes, I don't eat it. I'm gluten-free. Well, so I called the physicians at this company, and they're like, if they're swearing that they're gluten-free, check for parasites. And so what I've seen clinically is, I haven't run stool testing because I don't know that that's the most accurate way, because if the parasites are not in stool, you're not going to see them. Doing a white blood cell with the differential, looking at eosinophils, if those are high and their basophils are normal, it's definitely parasites. So what I've done is we've treated them for parasites, put them on different herbals and things like that. And their next test, their gliadin test is down.
Interesting.
So yeah, it's been very interesting in regards to the whole gut correlation and, to that test and things like that. So when we get the results back, treatment is totally different for every patient. Some patients, I use a lot of pregnenolone, which is a very big, precursor hormone. I will use, DHEA. And, the good thing about doing these, hormones through supplements is it's very easily regulated. So when I do rechecking of the patients, usually after about 3 months of the patient feeling very good, my job is to obviously fix the problem. So when I do testing again, I have the patients off of their things for about 4 days, have them retest, and then restart their supplements because I don't want them off of it for 3 weeks potentially. What I've seen clinically is sometimes when patients are off of their supplements for the 4 days before they do testing, when they restart them, they notice a huge difference that when they were off of it, they were not feeling good. So that's a huge indication to me when they come in for their follow-up that they still need it. And lo and behold, that usually shows on their testing.
Wow.
So, patients get better within a week. That is definitely a for sure thing. They notice some change, whether that's their sleep is better, their mental clarity is better, their hot flashes are less or less intense, because we fixed whatever the problem is. And if we fix everything that's abnormal on the saliva test and they're not feeling better, well, now we need to look at something else. Doing, the urine and saliva testing really unfolds everything that could potentially be wrong. And again, looking at the blood work, it's really covering all of our bases. And then just, taking every component, into that and then, treating the problem, and, people do really well. And my job is to not enable their problem, to fix the problem and then get them off of the things that I'm recommending. We do a lot of hydrocortisone, unfortunately, and that's because there was a supplement that was pulled off the market that had hydrocortisone in it, and patients obviously felt really good on that. Now you can actually buy it on Amazon for one bottle. I think it's like $350, so it's supply and demand. So unfortunately now it is a drug, that we have to prescribe. It is bioidentical, but and it's funny because patients that were on the supplement prior that are now on the prescription, they were hesitant at first. They're like, oh, well, I don't want to be on a drug, it's a steroid, and oh my gosh. And I'm like, but that was in your supplement, and the patients knew that from the beginning. I'm very upfront with people, and they're like, there was? And I'm like, yeah. And I'm like, if you want to feel better, this is what we need to do. So I don't have a lot of patients that have a lot of side effects or ill effects, just feeling better. And that's because we're confident in the testing that we do, and we're confident in our treatments. So, that's, in regards to the hormonal stuff, doing saliva testing, I feel is just very accurate. I have not seen yet anybody have good results from blood testing, but you also have to understand the industry I'm in. People are coming here because they're not feeling good. So I'm sure there are people out there, but they're not coming to see us here.
I like that. Really good information. And I have some, as you know, background in the industry, and we knew that product you're speaking of was spiked because we tested it and tried to emulate it and just couldn't get to the levels of that. So it's interesting.
We need somebody to do that. I know.
Right. So let's talk about that, the adrenals a little bit more. So we have pregnenolone, we have the hydrocortisone, and then what about the adaptogens? So talk about what sort of patterns you would see on the labs that would guide you when to use what.
So when I see borderline low cortisol, okay, that's going to be more, I think, indicative of looking at the adaptogenic herbs. But when cortisol levels are low, they're outside the reference range. For me, in my mind, I think adaptogens are good, but I don't want to kick a dead horse. I want to give the adrenals nutrition and nutrients, but they kind of need a little bit of a rest. With that said, if I give hydrocortisone to the patient, obviously they're going to feel better because the adrenals are having a hard time producing it. And again, this is not Addison's disease. Okay, that's a significant disease. They would not be in my office. So, and I don't even know if this is adrenal fatigue. A lot of people come in and that's the catchphrase, adrenal fatigue. I don't see that very often, just on the hierarchy of where their DHEA to cortisol levels are. But somebody can have a very low cortisol level and not have adrenal fatigue. So when people come in here, oh, I have adrenal fatigue or hypothyroidism, well, yeah, I mean, everybody has symptoms of that, you know, whether they have that or not really depends. And I don't get hung up in classifying or labeling or anything like that. But when a cortisol level is low outside the reference range, you give the body hydrocortisone, okay, and the adrenals can rest. I don't think it's appropriate to just focus on the adaptogens. I don't, because I just don't see the good results. It's going to take a lot longer for the patient to get better. It's going to cost a lot more money, you know, in regards to the stuff that they have to take. And my job is to get people from point A to point B, give them the tools, you know, whether it's the dietitian here or, you know, the nurse practitioner, whatever it is, give them the tools to try to decrease stress in their life. Because again, this is environmental, right? To change things. But I just don't see, I want to give adrenal support. So I'll use like glandulars, okay? So it's giving food to the adrenals. Give the body hydrocortisone, and the body's like, oh, good, there's cortisol there. Great. Now you're gonna have energy, and your hot flashes are gonna stop. You're not gonna have brain fog issues, none of that stuff. And then I'm gonna start to build up the rest of the hormones, okay, like the 17-hydroxyprogesterone, the progesterone, all of that, and people do better.
So Dr. Nickels, I really like that approach because we know that the adrenals, particularly in women, are responsible for then making a lot of the different hormones, not only just energy hormones, but sexual hormones, testosterone.
Right.
So this is a huge aspect, not only just throughout life, but particularly after and during menopause. Yes?
Right, exactly. So I really think that, and I think that plays a role in the whole low libido and the, you know, is it low testosterone and all of that stuff, because you know, the adrenals are dealing with so many other things that the adrenals are like, well, I mean, come on. That can maybe go on the wayside. And a lot of women do feel overwhelmed that, you know, it's like another check on their list. You know, it's like, oh, really? You know, I got to do laundry or I got to do the dishes. So again, it's that 80% environmental, 20% hormonal piece. But if they don't have enough DHEA, which is really how we're producing testosterone, which is an adrenal hormone, they're going to have some problems too. So, and what I've also found too from a libido standpoint is if I do see a borderline low saliva testosterone, which again is the free or unbound, a lot of times there's a lot of testosterone in the blood bound up. So what I've used is supplements. Can I say through Zymogen?
Yeah.
Oh, okay. Through Zymogen that actually helps to unbind that testosterone. So let's say, you know, the woman has 30, you know, saliva and, you know, I don't know, let's say 100 in the blood. Well, if she has 30 and normal might be, you know, 30 to 90 or something, if you just focus on unbinding the rest that's in the blood, now it's going to be available. So it's not about necessarily just giving more testosterone, because if you give testosterone, it doesn't mean it's going to be bioavailable. It doesn't mean that it's going to be at the tissue level. It could be all bound up in the blood. So people have to think about that too when they're giving, you know, different hormones. You know, make sure that it's available for utilization. So I guess for me, if you're gonna, you know, and what I've done is, you know, I'll definitely do, you know, the supplement first before I give testosterone. But if the testosterone really is low, I'll give both, because I want to make sure that that testosterone's not hanging out in the blood, that it's going to be bioavailable for, you know, the body to use.
Mm-hmm. So what I infer from that last statement is you're only giving pregnenolone and testosterone. I haven't heard you talk much about progesterone or estradiol. Am I right or no?
I've never given estrogen once. Perfect. Women have too much estrogen. That's what I see all the time. Or their estrogen is normal and their progesterone is low. So you still have this imbalance. So treatment for this person would be increased progesterone. Sometimes I see normal progesterone and high estrogen. So I don't want to do that, right? I want to lower this. So there's supplements that I use like DIM or, you know, IC3 or indole 3 carbinol to bind to that excess estrogen, eliminate it through the liver. But then sometimes to increase progesterone, I'll give pregnenolone and not even give progesterone.
Love it.
So I need to make sure that I'm fulfilling all the deficiencies, because it's usually not just a deficiency in progesterone. It's a deficiency in cortisol. It's a deficiency in 17-hydroxyprogesterone. So if you look at one thing to suffice 3 huge deficiencies, you're going to lose. And if you don't plug up the tub, if you make sure that cortisol level is not, that it's there, then things can start to fill up. But if you don't support cortisol, everything is going out the drain.
Describe that. You mean different metabolic pathways, but let's talk about that so people really understand, because I think I know where you're going, but I want to hear it.
So let's just say cortisol is the drain in a tub, okay? You have all these mechanisms to start filling up the tub. Cholesterol obviously is the first, okay? So let's say the cholesterol is the faucet, okay? When I turn the faucet on, it starts to release pregnenolone, and that's the water. Pregnenolone will convert to progesterone, will convert to 17-hydroxyprogesterone, and then to cortisol. So you turn on the faucet and water comes out. If you don't plug up the tub, if you don't make sure you're supporting cortisol, everything is going out. So you're never going to build up progesterone. I don't care if you slather progesterone all over your body until you support that cortisol, because that's what the body needs. You will die in the body's mind if you don't have enough cortisol. You're not going to die if you have hot flashes in the body's mind. You might think that, women might think that they are, but not necessarily. So you have to make sure that you're supporting cortisol. And this is the whole thought behind, infertility, where women will try, and men, they'll try to get pregnant, and then they throw their hands up and they're like, you know what? Let's just adopt. Stress comes down. They don't need as much cortisol. Progesterone increases. Boom, they get pregnant.
Wow.
I see it all the time with our infertility patients. All the time. I also see with our infertility patients, doctors prescribing, infertility medications, whether it's Clomid and stuff like that, but their follow-up is poor. They're not doing pelvic ultrasounds to see what's going on with the follicle. Is it growing? Do they need an injection of HCG? Is their LH surge low because their progesterone is low? So it's so multifactorial that it's not just about giving a medication. And again, cortisol, it's all about that cortisol. Mm-hmm. You have to make sure that you support that. So do I want to give hydrocortisone? No. Unfortunately, people need it. And that's just how it is.
Right.
So you guys got to come up with a supplement that can support that.
Right. I love that. So we talked about supplements, adrenal adaptogens, hydrocortisone. Let's talk about lifestyle stuff. So diet and then stress management. What are some tips that you recommend and have good feedback with?
Well, you should definitely find a good naturopathic physician to help with all of those things, because I don't know, as a mom, when people say, okay, this is what you're going to feed your kids, this is how you're going to raise your kids, you can read all the books that you want, but it's still hard to pick and choose what's going to be appropriate. So I think to have that guidance and that hand holding, you need. And you need to have that hand holding and guidance from somebody who understands how the body works as one. Going to an endocrinologist, going to an infertility specialist, going to a gastroenterologist, you're one person and everything works together. So, you need to find yourself a good physician that understands what's going on and can guide you in regards to what's going to be best for that individual. Mm-hmm. Because I can say, sure, don't eat gluten, don't eat processed foods, get 8 hours of sleep. But in the reality of things, a lot of people can't do that. So I can't say that to people. I can't say to, somebody who's been smoking for 30 years, who actually knows that smoking is bad, and sit there in my hour appointment and say, you need to not smoke. That's not my job. My job is to educate them and get them feeling better, because when people start to feel better, they make different changes, okay? A lot of people that have a lot of these addictive, personalities or, addictive qualities, a lot of times their dopamine is low. So there's always a reason why. People don't want to, drink a lot of alcohol. They don't want to smoke. They don't want to gamble. There's always a reason why. And you need somebody to be the guide to help people understand that. Because a lot of times they're beaten down. They go to the doctor, you're overweight, we'll lose weight. Well, a lot of times the doctor's overweight, and they're not eating well. But the patient's like, yeah, they say that every year. My cholesterol's high, I know. But what am I supposed to do? And they're not getting that guidance. So for a patient to come in here with high cholesterol, we need to get to the root cause of what's causing their high cholesterol. Well, and we all know too, cholesterol is not necessarily the problem, right? It's all about oxidation and then particle size and all of that. But we look at all of that. So you have to look at their environment. You have to look at what is attainable for them. Being in Wisconsin, what do we like here? Beer, brats, cheese, and you know what? So do I, but I don't eat that stuff very often, okay? So to revamp somebody's life, compliance, downstream, it's not going to work. I think things have been well for us here because I'm from Wisconsin. I understand the mentality, and I'm a realist. For patients to come in here and you're going to revamp everything that they do, they're walking out the door and they're not going to tell their friends how awesome we are. We don't do that. We meet patients where they're at. We educate them because it's up to them. They're the ones that fix them, not me. Patients will be like, oh, Dr. Nickels, thank you so much. And I'm like, that's great. I did my job for you and I'm glad. But you're the one, going to bed earlier. You're the one getting up and exercising. You're the one taking the supplements that I recommend. It's not about me. It's about what you're doing for yourself. And that's awesome. That is like a beautiful thing. And patients really learn to love themselves in a different way, I think, because it's not about laziness and taking a pill because the doctor on a pedestal told them that that's what they needed. It's about taking a proactive approach to their health and seeing the benefit and feeling good for the first time in a long time. Mm-hmm. So I love my job. I feel like I do right by patients every day. I can look in the mirror every day and say, you know what? I did right by my patients. And I feel very confident in the things that we do here. The people that I have here, I feel very blessed. And it's awesome. It's awesome.
Good for you.
Yeah.
I love that. So what I kind of inferred from that was kind of pick some low-hanging fruit. So find like a base hit, if we were to make a baseball analogy, for someone that's smoking, give them some sort of feedback or some sort of modality that would make them feel good but not make them feel bad by saying, stop smoking,
exactly.
like you said.
People know that. Don't focus on the negatives. Focus on the positive and give patients the reinforcement that they need to make different choices. Their primary care already does that every year. Your cholesterol is high, you need to lose weight, you need to stop smoking, you need to. But where are the tools? And most of these people, they don't feel good anyways. So let's get you feeling better, and then you're going to make different choices. We see it all the time.
Love that. So let's wrap up and talk about tools that you use. You've worked in the nutraceutical industry yourself,
yes,
and you recommend a lot of supplements. So if there was just one supplement on your shelf, the place is flooding and you had to grab it, which one would it be and why?
A digestive enzyme.
Let's expand on that one.
Because everybody has gut problems, so we see a lot of, our foods are overcooked and overprocessed. We all know that, right? So when we take food in, we don't have enough enzymes to digest it. So this increases food intolerance, this increases food allergies, this causes inflammation in the gut, increases leaky gut, all of that stuff. Stress also plays a role. So stress decreases hydrochloric acid production, which, increases your risk of, heartburn and, gas, bloating, all of that stuff. So, people come in here all the time with chronic sinusitis or ringing in the ear or, sore throat in the morning without being sick. And I'm like, well, you have silent acid reflux. And they're like, I've never had acid reflux. And lo and behold, they went to an ENT and they have silent acid reflux. And again, my job is to fix the problem, not enable the problem. So there are no PPIs that or, H2 blockers that we prescribe here. I mean, there's nobody in this practice on that stuff. We prescribe digestive enzymes, build up their stomach acid, support pancreatic digestion in the small intestine, and people are good to go. I mean, I've had people come here that have gone to Mayo Clinic for sinus problems. Give them digestive enzymes, and it's gone within a day. I mean, it really is that simple. This medicine and giving people the answers really is simple. It really is. So you got to support the gut. That is like the foundation of health is gut function, and so that would be it.
Love it.
Yeah.
So really great information here, Dr. Nickels. I'm sure people want to learn more about you. What's the best way online folks can reach out to you, connect with you, and learn more about your practice?
Yeah, so you can go to our website. The website is ifwcenter.com. You can always give us a call at 262-754-4910, and you can always contact us on the website as well. We have a contact, and send us an email. And I personally like to call people back. I like to reach out my hand, because if my services are not going to be beneficial to somebody, let's discuss it now. I'm not going to waste people's money. And I think reaching my hand out is really important too, because it helps with that connection already, and it just gives me more information to think, okay, well, when this new patient comes in, hopefully my dietitian is here, or my nurse practitioner if they need a physical exam or something like that. So I'm already thinking what is going to be the best for that patient when they come in. Fantastic. So I do like to instead of having my staff do it, I do like to take that initial call to the patient, potential patient. So
get that rapport going and
yeah,
communication.
exactly.
Love that.
Exactly.
Thanks so much for being here.
Yeah, thank you.